Since 1982, probably have averaged from 700 to 1,100 cases per year. When I started practice in 1982, the bovine graft was the graft that the Peripheral Vascular Associates utilized. Well, I think primarily at the time of surgery, the compliance issues are much better for bovine graft. It actually feels just like vein and works like vein, so the compliance is very easy. The apposition to the calcific arterial wall is very good. Again, it's just like vein. In our patient population, the arteries are very small, very calcific, and synthetic PTFE grafts sometimes hard to get apposition to the wall, whereas bovine graft is much easier. Another factor is bleeding. Again, it acts much like vein. There's rarely any bleeding after the anastomosis is performed, and rarely do we ever have to use Surgicel or thrombin to complete the hemostasis at the anastomosis. When we do have to thrombectomize the graft, it's much easier. There's no ingrowth of tissue within the graft. It's much easier to operate on when we have to reopen or thrombectomize the graft. The synthetic grafts, you can even see it at the time of placement of the graft. There's some weeping of the tissue, and because of that, there's usually a skin reaction. There's some redness on the tissue, and that usually delays the accessing the PTFE graft for at least 14 days. Whereas bovine graft, because of the natural collagen, there's no weeping, there's no skin reaction. I just think that's the preferred graft in my hands and in our group's hands. I don't think there's any other time that we would place PTFE over bovine graft. For me, it's a doctor preference, and I believe the patients just do better with the bovine graft. It's not unusual to see patients come back to the office 8, 10, even 12 years after placement of the graft, and they have not had any problems with it, and they are still utilizing it for dialysis.
I find them, in my 20-plus years of being a dialysis nurse, I find them easier to palpate, which makes them easier to cannulate. I think when you have a graft that's easier to cannulate, then you're going to have less pain for the patient upon needle insertion. I think with an easier graft to palpate, you can rotate the sites more, and you should rotate the sites more so you have less trauma to the graft, which would mean greater longevity of the graft and less hospitalizations, which in turn would create less stress for the patient, less expense, and hopefully they would not end up with a temporary catheter that could lead to infection.
Most of the time, they put these people on a hospital for another treatment and correct the graft and come back to dialysis a few days after. I have a very good graft. Yeah, no, I never have any problems during the 2 years I have with the graft.